Trigeminal neuralgia is one of the neuropathic condition in which the nerves, the trigeminal nerve, which is one of the major nerve originating from the brain, because it's called as cranial nerve, starts to send the faulty signals. So normal signals are being perceived as a painful signals. It's one of the most painful condition known to the mankind. There have been instances where the mental health of the patients deteriorates so bad that they even resort to self-harm. Again, why does it cause? The major cause of trigeminal neuralgia is what we call is idiopathic, when the cause is not known. There are some other neurologic conditions which can cause the trigeminal neuralgias, as in AV loop, which is a loop of vascular loop, which is from the blood vessels, which can incorporate your nerve root or nuclei of the trigeminal nerves. There are other neurodegenerative conditions as well, such as multiple sclerosis is one of the very well-known condition to cause trigeminal neuralgias. Trauma, dental work, TMJ dysfunction can also cause trigeminal neuralgias. Apart from that, various other nerve conditions such as vitamin B12 deficiencies, long-standing diabetes, they're all known to contribute to the trigeminal neuralgias. It all depends upon how severe your pain is. If you experience a very, very severe pain, which is a brief lancinating episode, when I say lancinating, I mean it's a very, very well-defined electrical shock-like sensation, which happens over a few seconds. The severity is reached to its maximum within few seconds, and then after some times it goes back to its original level of pain scores, or there might be a background humming of the pain scores. If this is what your pain condition is like, then it's likely to be a trigeminal neuralgias. Having said that, if there is any pain coming from the face, it's always good to get it checked. It might just be a dental abscess or a decaying tooth or a cavity, or something simple as temporomandible joint dysfunctions. But it's always and always better to get it checked with your doctor. As such, trigeminal neuralgia does not need any emergency medical treatment, but I would suggest that if the patients have been driven to the end of their tethers, if they are experiencing a tremendous amount of social distress, or they are not able to manage their day-to-day activities very well, or if they are experiencing the side effects from the medications that has been prescribed for trigeminal neuralgias, in those conditions, I would definitely suggest seeing a specialist. It can be a pain specialist, it can be a neurologist or a neurosurgeon to come and see for your condition. Like I explained to you before as well, trigeminal neuralgias, majority of them are idiopathic. When we say idiopathic, it means there's no cause to be found. Some of them are associated with vascular loops. Vascular loops are nothing but aberrant blood vessels which are looping against the nerve. Anatomically, they are not supposed to do that, but there are various conditions which can make them do that. Most commonly is the vascular diseases, diabetes, smoking. Those can be the conditions which are leading to this vascular looping. So it's always better to get it checked. There are various tumors or the cancer-like conditions as well, which can cause trigeminal neuralgias. And there are some very, very debilitating diseases like multiple sclerosis, whose first sign could be trigeminal neuralgias. There are some various other minor causes as well, such as various vitamin B complex deficiencies, vitamin D deficiencies, which can lead to this kind of trigeminal neuralgic pain. But I would always make sure that if I am having certain conditions which points me towards the trigeminal neuralgia, as a patient, I would definitely seek at least a GP's opinion or a specialist opinion. Yes, there are various non-surgical options. First thing first is patient education. So when you see a pain specialist with a special interest in trigeminal neuralgia, they can run you through various informations. Second option of non-surgical treatment is to have a medications. Uh, the limitations of your GP or general practitioner in terms of prescribing you this medication is because they are waiting for specialist input. Your pain management specialist can have a recommendation to a wider range of medications, because the first and second line may give patient side effects, then they can resort to third and fourth line. Other option is to do various targeted injections. These targeted injections could be just local anesthetic injections. They can be local anesthetic supplemented with steroid cortisol injections for a longer acting pain relief. And the next step in this is to do a rhizolysis, which basically means buzzing those nerves or passing electric current through those nerves to make pain relief last longer. Again, as we are advancing in our understanding about trigeminal neuralgias, the previously invasive methods of injections have been much less invasive now. There is a direct real-time imaging with help of ultrasound guidance and X-ray guidance. We can resort to rhizolysis medications at much peripheral level. We can do selective nerve root blocks of the trigeminal neuralgia, so you don't have to buzz or destroy the trigeminal ganglion, which is a central structure, but we can come fairly peripherally now and do a selective trigeminal branch block